It was Heart Valve Awareness Day, Heart Valve Disease Awareness Day, which was on the 22nd. And it's kind of recognized always in February because it's part of the American Heart Month. Basically, February is Heart Month, Heart Awareness Month, and February 22nd was designated for Heart Valve Disease Month. Not necessarily just aortic valve disease issues, it's any valve. Okay, but obviously, we're not here to talk about mitral valve. We're here to talk about anything that would happen with your aortic valve. But the goal of this day is to kind of aim to raise awareness, to just basically talk about heart valve disease, specifically aortic. And this annual day focuses on educating people about risk factors, about symptoms, about how to detect if you have an issue with a heart valve, and to kind of, I guess, help reduce the burden of any type of heart valve disease. But more than 11 million Americans actually have heart valve disease, yet 3 out of 4 Americans they just know little to nothing about it. And that's because it's typically not symptomatic until there's an actual issue. And this goes for all your valves, okay? But we're going to specifically focus on the aortic valve. And aortic valve disease would be a group of conditions that would affect your aortic valve, which is responsible for managing the blood flow out of your heart through the aorta and to the rest of your body. And there's two main types of aortic valve disease. And that would be, as we mentioned before, aortic valve stenosis or aortic stenosis, which is how it's typically described by physicians. They just dropped the word valve altogether. As Dr. Udelman said, it just became too wordy, so they just call it aortic stenosis. But in this condition, the aortic valve actually becomes narrowed, which prevents it from opening fully. So as a result, you're getting a less amount of blood flow through that valve and into the aorta. So part of your symptoms could include feeling chest pain, which is called angina, or feeling tightness. You could feel faint. You could feel lightheaded with exertion. You could feel a shortness of breath, especially during physical activity. And you could feel fatigued, especially during times of increased activity during your day. That would be stenosis. Now, another type of aortic valve disease process would be called aortic valve regurgitation, and that would be called aortic insufficiency. And so in this particular case, it's almost the opposite. The aortic valve just doesn't close tight enough. It becomes like almost floppy, right? And so when it doesn't close tight enough, now you have blood leaking backwards into the heart or regurgitating into the heart. And so the symptoms of that, which some are similar to stenosis, could be shortness of breath during times of exercise or when lying down. You could feel tired or have some weakness, especially during increased activity. You might start to develop an irregular heartbeat. You could feel some lightheadedness or fainting, and maybe even a chest pain or discomfort that worsens during exercise. Now, you're not going to feel these things when it's a mild or trace amount of regurgitation or stenosis. More of your symptoms are going to appear the further along the disease progresses. And a lot of these symptoms really occur, or they are found rather, during your echocardiograms. Okay. And risk factors for these conditions, for these aortic valve diseases, include typically being over the age of 60. Okay. I'm not over the age of 60. So that's just a typical. That is not in everyone. And I know a lot of people who have issues with that valve as well as other valves that are under the age of 60. So these are just a guideline, okay? If you have bicuspid valve, for sure. Now, bicuspid valve is not a disease. It is a congenital heart defect. It is something you are born with. It is not something that it turns into in your late 40s. You are born with 2 cusps instead of 3, but you can also be born with 1 cusp. You could be born with 4 cusps, and rarely you can be born with 5 cusps. Anything outside of the normal 3 would cause a potential issue with blood flow back and forth in your heart and in your aorta. In this particular case, with the aortic valve being bicuspid, that could lead to aortic disease. You also could have an aortic disease situation because of another congenital heart disease or defect. Radiation therapy to the chest. Let's say you have breast cancer or any other cancer, lung cancer, cancer that's in the chest, Hodgkin lymphoma. Also, if you had rheumatic heart disease. So the risk increases with age as you get older, and early detection really allows for more timely treatment. So remember, if you're experiencing symptoms that are suggestive of aortic valve disease, as mentioned above, it is important for you to seek medical treatment. So don't hold those symptoms just inside, and don't dismiss them for, well, maybe I'm just, out of shape and I haven't done a lot of walking. No, you know what? If you're feeling some shortness of breath, if you're feeling a little bit of chest discomfort, and you've been noticing this happening, not just infrequently, but more frequently, it is time for you to say something to your physician, because regular checkups and awareness can help them catch any kind of problems early and ensure the appropriate management, whether it's medication or it's some other form of treatment. So if you have questions, you really need to discuss them with your physician. Do not assume you have an issue with your valve, but do not assume that you do not. So it is something for you to have a conversation with your doctor about. And that was our information for Heart Valve Awareness Day. There you go.